Hi everyone, this is Nathaniel, one of the directors and exercise physiologists here at Activate Exercise Physiology, and today we wanted to put together a short audio podcast to discuss pain, which is a really complex and interesting topic and something we work extensively with at Activate, whether it be acute/short-term pain or chronic/long-term pain, which has been occurring for more than 3 months. As with many things in the health world, there are many varying opinions out there and potential unhelpful beliefs which can influence an individual's pain rehabilitation. At Activate, we are really passionate about getting people back to doing the things they want to be doing in life out of pain, and we often notice these unhelpful beliefs that clients may have heard or read elsewhere, such as on the internet, that can negatively influence their pain rehab. So we want this podcast to be a resource to trust and refer back to in future. One of the concepts we really want to touch on today is that pain does not always equal damage, and to discuss when we are okay with some pain and that it can be okay to push into this to an extent, but not ignore it completely. This is a really common concept in chronic or long-term pain, where often the injury that may have caused pain initially has healed, and where pain is no longer an indication of damage. Arguably, in any pain rehabilitation, the most important thing is that you and your team, whether it's ourselves or us working in conjunction with other allied health professionals, understand your pain and have a good explanation for what is going on and that you feel safe even though you may feel sore. One disclaimer, and to acknowledge when we are not okay with pain, is if there has been a recent physical trauma which hasn't been properly investigated, or if symptoms continue to dramatically worsen, in which case we may need to escalate care or investigate further. But if we're talking things like years of lower back pain or achy joints or achy tendons, these kind of things, but no strong physical reason for your pain, such as an injury or diagnosis from a scan or anything else requiring urgent attention, then this will apply more to you. So in these cases, best practice might actually involve occasionally poking into pain, and this is a concept I'm going to come back to later on. But an analogy we often like to tell our clients is one we heard from a physio named Greg Lehman, who describes pain as a cup, and that many things contribute to this cup of pain. Obviously, the more full the cup, the more pain we experience. And things that fill the cup include physical trauma, as we would have guessed, but also non-physical stimuli such as stress, past experience, fear of movement, anxiety, depression, and false beliefs. A story that I've probably told a few of you before, and that I use to describe how non-physical factors can contribute to this cup of pain and cause real pain, is a story by Lorimer Moseley, who is a professor of clinical neuroscience and investigates pain in humans. Lorimer is also an avid bushwalker, and he describes the situation where he was out bushwalking one day and he was flicked in the leg by a stick. And he goes, "Okay, pause. What happened on a physiological level there? The receptors in my leg sent a message up to my brain saying, 'Hey mate, you've been flicked in the leg by a stick. Nothing to worry about. Carry on.' So he keeps walking pain-free. A minute or so later, Lorimer realized that he'd actually been bitten in the leg by an eastern brown snake, which is one of the most venomous snakes in the world. I think he said statistically a 50% chance of survival. He's airlifted out of the bush, rushed to hospital, and luckily he pulls through. A few months later, and Lorimer's back to bushwalking. Once again, he's flicked in the leg by something, and he goes, "Okay, pause. What happened this time physiologically? This time, the pain receptors in my leg sent a message up to my brain, where pain is created, saying, 'Hey mate, last time this happened you almost died. This is a really dangerous situation, and we need you to let him know that he's in danger, so we need to elicit pain.' And Lorimer swears by this, but he then dropped to the floor in the most excruciating pain he's ever felt, only for his friends to rush over, investigate the wound, and look at him like he's gone mad, because all they can see is a light scratch, probably from a stick." So what was the difference between the two stories? If anything, physically, you'd think the first scenario of the snake bite would have hurt more than the stick flick. But it was the second situation which created real, excruciating pain. Now, why was this? And the answer is that Lorimer had had a past experience, which his body had perceived as dangerous, causing it to elicit pain. And this is what we see a lot in chronic pain. So, for example, someone who previously injured their back picking something up from the floor. And they might come to us 1-2 years later still in pain. They've had scans, all seems clear, and we know that on a structural level, their injury has now healed. We know that 97% of disc herniations resolve within 12 months, and that this person is capable of picking that object up from the floor now, but they are still experiencing real pain. So the conclusion or moral of the story is that pain and tissue state are poorly related. So someone might be experiencing real pain, like Lorimer did, like someone with low back pain does, but it does not mean that at a tissue or structural level, damage is occurring. So I often tell these stories to you guys to educate and explain to you how many factors can contribute to this cup and cause real pain. Obviously, we're not for a second telling you that your pain is not real or that it's in your head, because that's just not true. Lorimer experienced real debilitating pain, as he describes himself, when being flicked in the leg the second time. And the client who is still experiencing pain picking that object up from the floor, even if their injury has structurally healed, is still experiencing real pain. We're just trying to point out that this might not always be due to a threatening or dangerous situation, but it might be due to a non-physical stimulus, such as past experience. What often occurs as a result of this is a hypersensitivity of our nervous system, which is the system that encompasses our brain and the nerves that send messages to and from it. So basically our brain is on high alert. An analogy I use to put this simply is that of a smoke alarm, and that the nervous system or brain becomes a smoke alarm that isn't set off from a normal amount of smoke, but instead a tiny amount of smoke, and therefore creates a pain response. Like the example of Lorimer being flicked in the leg by a stick. Normally something we would pay no attention to, but in his case, and given his history, something that his system perceived as dangerous and caused debilitating pain. And this is an issue of sensitivity rather than damage. Some other examples of this include tendinopathies, which a lot of you have seen us for in the past, where basically the muscle tendon begins to break down and typically results in pain due to a recent or long-term spike in load. In which case, recent evidence tells us that there are actually benefits in rehab to eliciting some pain or discomfort, and that this is actually recommended in order for that tendon to adapt. Generally a 3 or less out of 10 level of pain, which I'm sure you've heard us say at some point. And if you're not eliciting this 3 out of 10 or less pain, you may potentially not be challenging the tendon enough and not preparing it for the demands placed upon it afterwards. Another really common example is that of osteoarthritis, which is the degeneration of our joint cartilage that occurs over time, where the irony is that the thing that can sometimes hurt physical activity is the stimulus that helps us tolerate more activity. Exercise has also been shown to have an analgesic or pain-relieving effect for the symptoms of osteoarthritis, as it increases the lubrication to the cartilage of that joint. One of the reasons why we coined the expression, motion is lotion. A way I heard it put recently, which I really liked, was by the same physio, Greg Lehman. And he described that pain should have a seat at the table. We listen to it, we don't ignore it, but it doesn't get to be the dictator, because when it is, we start to lose control. And he went on to talk about the theory of poking into pain, which is what I touched on earlier, and when it might be okay to do this. When it is okay to do this, similar to the examples I've given above where we know that pain is not resulting in damage, we give ourselves permission to resume the activities that feel scary and painful. And if we feel sore but safe, we can start getting our life back. But if we wait to be 100% pain-free, we might never start to do the things that make us, us. And this is how we use physical activity. We use exercise as a means of graded exposure to show you that it's okay. We're not associating this with damage. You're safe, even though you may be sore. So we're building you up and slowly calming or desensitizing this overly sensitive smoke alarm. One final thing I want to touch on is that the relationship between rehab and pain is also dependent on the type of injury we're dealing with. So it's really important that this be individualized and that we formulate a tailored plan. One thing is that for sure is that rest is not always the answer. Rest typically means that pain will not occur, but in turn, what is actually happening is that we are reducing this tissue's capacity. So as soon as you then demand something of this tissue, it's likely a pain response will occur, as you are demanding more than what it may be capable or comfortable with. A personal example I like to use, as I know many of you have seen me in a shoulder sling at some point, is that if I was to leave my shoulder in that sling for an entire 6 weeks and then took it out and tried to do the normal things I would expect it to do, because at the end of the day it's rested for 6 weeks and it should be healed, it's likely I would experience some level of pain because I haven't gradually exposed it to various safe stimuli throughout that 6 weeks. So it's really important I do this, and it's okay to know that some discomfort is okay, as long as it's safe, responding well, and continuing to progress. This is why a tailored plan is really important, as I mentioned before, if it is an issue with a tendon, recent evidence shows us that some level of pain is advised and beneficial in rehab. But if it's an issue with bone, this might not be the case, and we may require rest short term to allow this bone to heal. Whereas non-specific pain, which is pain where there is no physiological reason for your pain, such as an injury, something diagnosed from a scan, or anything else requiring urgent attention, it could mean that, in these cases, other things in our cup of pain, such as stress, past experience, or false beliefs, are contributing to or even causing the pain, like it did for Lorimer. It doesn't mean it's not real, it's just not threatening, and this is why we can't let it stop us living our lives. So I hope you guys found this to be educational and interesting, and we'll definitely be sure to put more things out like this in the future. Thanks, guys.